I'd just gotten home from work. It was about 4 o'clock in the afternoon. I was just doing my regular stuff, changing my clothes and that kind of thing. Went to change my pants and couldn't, I was having a hard time getting a hold of my pants to pull them up. Next thing you know, I really didn't think much about it, just thought maybe my hand was asleep or something. But next thing you know, my phone was ringing. I picked up my phone, answered my phone. It was actually work trying to call me back into work. I noticed I having a hard time holding on to the phone. I dropped the phone a couple times right in a row. The phone rings again, it's my mother on the phone. Talking to her, still having problems holding on to the phone. And by this time, I think I'd finally actually gotten my pants pulled up and dressed and everything, but not really still feeling right. So my mom says, hey, I'm gonna head over and see you sound like something's going on. By the time my parents had came over, they both realized that I was starting to droop in my face. My left side was starting to droop. So at this point in time, they call the ambulance. Basically, at that point in time is when they told me you're having a stroke. Well, after they got me into the emergency room, they started telling me that they were going to administer this new drug that if they can get within 3-hour time span of the onset of the stroke, it will actually bust the clot. I had one of the rehab ladies come in and we kind of did some small stuff, where she was testing my arms and I had to walk and do some certain exercises with my hands and lifting and this, that, and the other, touching, make sure I could touch my nose and all that stuff. And from my understanding, I didn't have to go through too much because it was going pretty well from the beginning. I lost a little feeling in my left hand, which is now starting to come back, but the only thing is, as it's coming back, instead of being a numbness, I have a little bit of a tingling sensation, kind of a burn throughout my whole hand. If I'm holding on to something for too long, instead of my hand just getting tired, I kind of feel a burn. The only other thing is if I get to speaking too fast, my words get a little jumbled up. It's the flap where your mother passes oxygenated blood to the baby. Mine, for whatever reason, never closed. It should close after you're born. Well, mine never closed, and somehow, some way, that's what basically, it had not been for that flap being open, they said it was a good chance I might not have had the stroke. So for whatever reason, the clot, once it formed, actually, they said basically what happened, at some point in time, I stood up. And probably at that point in time, when I stood up, that clot was able to pass through the flap. So I've actually gotten that repaired since also. I wish I would have known that it was happening. I wish I would have known more about the signs and that kind of thing. I mean, luckily it worked out well for me, but they say that a lot of people kind of don't realize what's going on, and it gets past that time frame, and then you are in real trouble. If I would have thought a little bit more about what was going on at the time and maybe realized what was happening, then that would have probably been a little better. Just try to live a little healthier, I guess. Kind of watch my diet a little more. I was always a fast food pizza, kind of trying to keep on that a little better. I smoked for 20 years, and I'm now 12 weeks smoke-free. Great, the nursing staff was very nice. I mean, I never had to ask for anything. If I had any questions, the family had any questions, they were very helpful. Always kind of, it was a good experience. I mean, really, the heart hospital was very nice. The doctor I had there was a really good, young guy, really good guy, and really made me feel a lot more comfortable about going through with the procedure, as far as getting the flap fixed.